dear friends. Today, I wish to talk about a condition known as amenorrhea. Amenorrhea is in our parlance described as a condition where a woman ceases to menstruate for various reasons. Typically, it is described as a cessation of menstruation for three menstrual cycles or up to 6 months. So that typically describes a woman who has been previously menstruating. However, in a situation where a woman has never menstruated but has gotten to the age of puberty, we describe it as primary amenorrhea or delayed um, puberty or delayed menarche. So in such situation, um, it's usually a source of worry for women, especially those who are experiencing secondary amenorrhea. Cessation, which is typically may not be, the cause may not be known to the individual. Well, in this video, I'm going to describe the various types of amenorrhea that usually occurs amongst women, especially those who are still young and within the age of 15 to 49 years, which is described at the age of reproductive age range. So, number one, once a woman misses her period, the first thing that should come to mind is pregnancy. And that goes to say that any woman who has missed her period should have a good reflection to find out if there has been any exposure to unprotected intercourse, which the person should either accept or reject. And then, if that is the case, the person should make attempts to make a diagnosis of pregnancy, yes, by conducting urine pregnancy test, or better still, conducting serum pregnancy test. Now, the second thing that could also bring about amenorrhea or cessation of menstrual flow is breast discharge. Milky breast discharge, also known as galactorrhea, is a condition that is predisposed by elevated prolactin level in the blood, which we call hyperprolactinemia. It's a situation where the prolactin levels, inhibits ovulation, which results in cessation of menses as well. So this often happens when, in fact, it's one of the commonest factors in women of reproductive age, apart from pregnancy. So once pregnancy is ruled out, hyperprolactinemia or galactorrhea should also be ruled out as well. So that is number two. Number three is a situation where a woman may have had what we call uterine synechia, addition of the endometrial cavity. That layer of the uterine cavity that is shed during menses oftentimes may be lost to either excessive curettage during termination of pregnancy, or may be caused by infection. So that during the process of resolution of the infection, healing takes place, and then the endometrial cavity is replaced by fibrous tissues, so that the anterior and posterior wall will be adhered together, and then the cavity will be lost completely, so that the woman ceases to menstruate following that. This is common in our environment because infection is common, especially pelvic inflammatory disease, sexually transmitted infections like gonorrhea and chlamydia infections. Some of them may follow terminated pregnancies. It may follow unsafe abortions. Some of them could also follow pregnancy events, like a woman who has just delivered and then developed postpartum infection, endometritis in particular. This can result in uterine synechia and then amenorrhea. So typically, these three are the key main factors in our environments. I mean, when I say in our environment, I mean low resource countries or low and middle income countries like Nigeria. Those living in developed nations, it might be as a result of other factors like hormonal imbalances can result in that, such as polycystic ovary syndrome. Amenorrhea is one of its presentations, right? So it's one of the things that it could also present with. So in a nutshell, I know that there are some drugs as well which are capable of inhibiting ovulation that can also predispose to amenorrhea. In our subsequent series, I will be talking about these drugs that can predispose to amenorrhea and possibly give a source of serious concern to our women. So, but in all, I wish to advise that whenever your menses ceases, shouldn't be worried so much about it. Just have an introspection, reflect on what has happened, and then present to a gynecologist early, as soon as it is detected, for the gynecologist to assess you and then make a diagnosis before offering a particular treatment for you. In the subsequent series, I will also be talking about the treatment options available to you. Thank you. Always try to check in on us on live stream Specialist Hospital Online or Women Health Corner on Facebook. We also have Women Health Corner on the YouTube channel. Thank you. See you in the next series.